Doctor's note on the liftoff.
Sawubona Sister P.
Sawubona Njabs, thanks for having me. Ngiyabingelela nakubalaleli.
Ngiyadlala Sister P phela yalifakwa uzongidinela Sister Precious. Xa Sister Phumelele man wise yabona sengibamba indaba ka Precious Sister Phumelele, my apologies. Talk to us about breast cancer. We know ukuthi cancer is isele suke wrong ngasho kanjalo wrong. Is it the same when it's breast cancer noma ayahluka ama cancer according to where in the body they are and what is essentially wrong?
Okay. Kahle cancer, it's a disease when Njabs which alters the DNA yama cells wethu. When we specifically speak of breast cancer, we speak of ama cells within milk duct as well as ama cells kuma lobules. So these cells get aya altered, then they end up growing rapidly and uncontrollably kugcine sekufomisheka ama malignant tumors. So the reason why you find there are cells that travels which we call it in metastasis. So they travel to other body parts and affects amanye parts. This is all sometimes ubane breast cancer, then usuthola ukuthi usune cervical cancer, usune bone cancer, because they do travel through your lymphatic system or your bone, your blood system as well. So currently we have two types of breast cancers. We have one which is very much common, which is called invasive ductal carcinoma, and then the other one is invasive lobular carcinoma. Meanwhile, lenye cancer is mostly found in the duct where the milk is.
So that's then specific to abantu besifazane.
And then basically the other one is found in the lobules. Lobules is normally the glands. So nakubantu besilisa, yes, because they do have breast tissue, kubona, so they do have sometimes cancer in that area.
How common, sister, is breast cancer amongst population yase South Africa?
In South Africa, the latest statistics shows ukuthi 1 in 27 women will be diagnosed with breast cancer. It is a lot. Although it is mostly common in women 40 years and above, it can be found in other age ranges as well. As mentioned again, they might find cancer.
So with any disease or any illness, it's always said early detection can be the difference between being able to save your life and you succumbing to whatever illness that you have. Ama early warning signs mhlambe kuyiwona azosiza si detect early breast cancer imaphi?
Yes, kubalulekile impela for early detection, because we always say early detection saves lives. And with cancer, you can be cured if your cancer is caught up quite early. We do have an assessment where umuntu wesifazane can do at home, which is a physical assessment whereby you lie flat on your back and the arm yale libele ozolcheka ilona ebanga phezulu ekhanda lakho.
So take your arm and put it above your head.
Above your head in this motion, and then you use a circular motion with your alternative hand in the breast, around the breast, and ngaphansi kwekhwapha to check for any lumps or thickening around that area, as well as swelling. And if usubuka ke manje esibukweni, you look at your breast, you check ukuthi ayalingana, awavuvukele, awashisi, awunayo pain, awanazo ifaca, like muwabuka ngathi manje ase distorted or elinye likhulu kunelinye.
Ama dimples siyawathanda kodwa hayi
emabeleni. Yes, no, not emabeleni. Sometimes you'll have pain as well kuyingono zakho, and sometimes ingono ishone phakathi or izocracker, and sometimes ikupene discharge, but it discharge more dangerous kuma isukhipha igazi. So all of those things that ongakwazi ukuyichecka zona ekhaya uyibona ukuthi no man nginaloku, let me go to my clinician, which is udokotela or a clinic or esibhedlela, ukuthi no khona lokho ngikubona ngisacela ningicheckisise. Remember, these inkomba zisuke zingasho ukuthi maybe une cancer, because sometimes you just do have ilampu, but it's not carcinoma, it's not cancerous, it's non-malignant. So lokho ukukunikeza ukuthi uhambe uye esibhedlela or a clinic uyocela ukuthi check.
You know, with a lot of other diseases, mhlambe into yenza ukuthi kungasheshi detecteke mhlambe ukuthi khona inkinga ekhona noma i-treatment treatment odokotela no nurse bengakwazi ukuqalisa early is because people are afraid of falling under the category of people that are sick with this, because there's stigmas attached to izifo. Do you find the same with breast cancer? Does umsebenzi wenu become harder because there are stigmas attached to breast cancer, and so people are more resistant to checking themselves and coming to you mangabe besola ukuthi konke wrong?
That is correct. Besides just the stigma itself, kunale notion ethi no akusona isifo sabantu abamnyama. I-cancer has never been isifo sabantu abamnyama, into esingayazi thina. So if uba ne-cancer, it could be it's a curse or uloyiwe. So abantu banalo ukuthi no, I'm not going to do that. So they'll always dilly-dally or bahambe bayofuna ezinye olunye usizo uma ngabe bobona into, or they self-medicate bengafuni ukuzo-confirm. So there is stigma around cancer as such. Unfortunately, it does affect every human, whether we race, and unfortunately, lately we have a high rise of even cervical cancer within the community ethu yabantu abamnyama. So abantu abahambe bayoyichecka, ukuyichecka igona okubalekile. And unfortunately, with any type of cancer, without these tests being done and confirmed in hospital, ngeke uzuzazi ukuthi unayo, because with cervical cancer you need to do a pap smear. So if utuyasaba ukwenza pap smear, how will you then know? Because that's the only way you will know. As well as the breast cancer as well, you need to do this checkup on yourself. If ubona into ongayiboni kahle, then you go to a clinician uthatha amagazi, because you can do cancer screening using blood as well. You can do a mammogram as well, or like the signs and symptoms also are a telltale to your clinician when you give history.
We've got Sister Phumelele in studio today for eDoctor's Note. We're talking about breast cancer. We are trying to raise awareness. We are in the month of breast cancer awareness.
Doctor's Note on the liftoff.
Gagasi FM 1033 takes us back to eDoctor's Note. Today we're zooming in on breast cancer, the things that you should be aware of to try and perhaps minimize the risk of you getting breast cancer, if you can do that at all, but also to detect it early so that interventions, medical and otherwise, can be tried early on, and that will of course increase chance yako of beating the cancer. And to talk to us about it, I've got in studio with me Sister Phumelele Dlamini, usebenza lapha kwa Mlazi at the Precious Women's Reproductive Health Clinic. Sister, you mentioned ukuthi siyakwazi ukushaya ama self-test ekhaya, right? Should we be considering these as mammograms? So if ngizoshaya mina self-test, no self-test mhlambe ishawo umuntu wami.
Okay.
Can I consider myself as having done a mammogram?
No, not quite, because a mammogram is a more intensive test where it's like an X-ray that looks into your breast tissue and your nodules and the tissue surrounding your breast, because sometimes you've got other lymph nodes and you might find it says, so it is quite important. Yes, it is expensive, so if maybe ungakakwazi ukufinyelela kuyona, we then do self-assessment, or you go to unesi or udokotela and ask them to do the assessment, the physical assessment themselves, and as well take amagazi as well. They are more reasonable in the cost of doing so. You can do those as well.
When should I start doing either my self-screening, normal going to the doctor? And are there people who should do them more often than others, that have a history of breast cancer ekhaya? Talk us through that.
Yeah, that's correct. Like I said earlier on, the age mostly where we find it common to detect breast cancer it's about 40 years. But however, due to genetic factors and hormonal factors, or family history as well, when there's a history of cancer at home, we always encourage abantu besifazane, even if as early as young as they are, to do a test for cancer. So in gungasho nje ukuthi as soon as usuthombile usuyintombi wesifazane. If kungekho history, yes, you might not rush, or however if kune history then you will be able to encourage ukuthi njalo uhlale test. Self tests are easy. Before your period you can check your breast. That's when you will know, because there's a lot of hormonal changes around your period cycle during that time. So
sometimes attend
yes. So you start checking them prior so that you will know after your period if they're not men. Bengu checking nje 5 days ago, this thing was not there. Manje yini lesi feel as if ilokhuzana ngapha, and then you kind of monitor yourself kanjalo. So yoba ke ngisho ukuthi ukuthomba, that's when we all go on our periods, so we can start checking, because abanye abayazi history yokuthi ekhaya mhlawumbe khona ugogo or ukhokho or esidini la kababa ongamazi who had cancer, so you really don't have that history. But if we're privileged to have that history, please, and it's something that I always encourage young women, because when you take history, especially the reproductive history, a simple question is, when was your last normal period? They are not aware. To say, please, umuntu wesifazane must be aware of these things, and how abantu basekhaya banye way with their periods, or any illnesses that are surrounding the reproductive system, or any cancers in the family, because that's a history that we will take or ask or derive from treatment plan yakho, assessment plan yakho moving forward ukuze uthole usizo. All right.
Are there any known lifestyle links to prevalence breast cancer? So if I am a smoker, if I am a drinker, does that put me at a higher risk?
Yes, Njabs, it does. Smoking has always been associated. Singabisabala ku-smoking walk. Ngithi khona nabo vapors, khona nabo izinto ezi-tobaccos abayisebenzisayo, all those things that has tobacco links to having breast cancers. Alcohol consumption as well, maintaining be healthy, gym, you're not moving. And also for women that are over 40, when you start menopausal, it is dangerous for you to gain a lot of weight because it puts you at risk. Abantu abangancelisi, as much as we now have choices in terms of breastfeeding or not breastfeeding when sithola bantwana, sometimes when you don't breastfeed, it also can contribute in putting you off at risk.
Really?
Also, yes, because when you breastfeeding also has benefits of reducing cancer of the breast, because there's it reduces chances of hormonal changes or cellular changes in the breast or genetic mutation.
Okay.
So if you breastfeed between 1 to 2 years or even more, it reduces your chances even less. So yeah, uphuzo konke lokho, even avoiding ukuba exposed to radiation. Some people work in radiation spaces. So
radiation in X-ray.
So X-ray. This is why muye X-ray uyabuza ufaka le yanto isindayo sometimes, or uyabuza ukuthi are you pregnant, because radiation is quite dangerous to ourselves. But khona abantu abasebenza naseyinkampanini ezinama-toxins that are also can afford. So if they have precautions in those companies, in those work area environments, bakwazi ukuthi babasiza abasebenzi babo in limiting and reducing the risk.
Sure. All right. Let's talk about treatment options that are available. Nakuge, the worst has been delivered to me. Uguti, I do have breast cancer. What kind of journey in terms of treatment am I looking at?
Treatment available currently for treatment of cancer holistically, we have irradiation and we have chemo. We also have surgical interventions. We also have immunotherapy and hormonal therapies that are available. It is quite an intense journey, and unfortunately in South Africa we have a lot of backlog because we don't have a lot of specialists that deals with cancer, and the burden is a lot also on the public sector as well, because like I said, cancer treatment is quite expensive as well. So you find that a lot of abantu depend on the public sector in terms of treatment. So it does become a long journey. Abanye bagcina bengatholanga naloma services in getting treated because they are so long in the list. Ukuthi aqale chemo or aqale radiation. By the time they get there, maybe waye diagnosed stage 2. By the time seyoqala stage 4, so segu very very difficult for it to combat or even cure or ilokhuzane cancer. So those are all the challenges that we have.
Gagasi FM.